Um, Hello, everyone. Thank you so much for joining us this evening. I'm Bonnie Blomeyer. I'm one of the account directors with Wellness Pharmacy, and we're super excited to have Dr. Pamela Smith speak for us again on the topic of hormones. You guys are in for a real treat. Pamela Smith, MD, MPH, MS, spent her first 20 years of practice as an emergency room physician with the Detroit Medical Center, and then 24 years as an anti-aging functional medicine specialist. She's a diplomat of the board of American Academy of Anti-Aging Physicians and is an internationally known speaker and author on the subject of metabolic, anti-aging, and personalized medicine. She also holds a master's in public health degree, along with a master's degree in metabolic and nutritional medicine. She has been featured on CNN, PBS, and many other television networks, has been interviewed in numerous consumer magazines, and has hosted 2 of her own radio shows. Dr. Smith was one of the featured physicians on the PBS series, The Embrace of Aging, as well as the online medical series, Awakening from Alzheimer's and Regain Your Brain. Dr. Pamela Smith is currently the director of the Center for Personalized Medicine and the founder of the Fellowship in Anti-Aging, Regenerative, and Functional Medicine. And Dr. Smith was recently the co-director of the master's program in Metabolic and Nutritional Medicine at the Morsani College of Medicine, University of South Florida. She's the author of many best-selling books, some of which include What You Must Know About Women's Hormones, Why You Can't Lose Weight, What You Must Know About Memory Loss and How You Can Stop It, What You Must Know About Thyroid Disorders. Her new book, What You Must Know About Vitamins, Minerals, Herbs, and So Much More, was released this year. And her newest book, How to Maximize Your Immune System, will be released this fall. Dr. Smith's new television special will air this year on PBS and CNN. So without further ado, we'd like to introduce our speaker, Dr. Smith. Go ahead.
Hello, everybody. Hope you are all doing well. We're going to look a little bit at hormones tonight from the perspective really of what people would think if you're not a scientist or a physician really looking at hormonal therapy. So we're going to look at women of all ages. We're going to focus initially on perimenopause and menopause, and then look at younger women as well. We're also going to discuss companion hormones of DHEA, cortisol, pregnenolone, and melatonin. Also, we are going to have some newer references on the slides that focus on the questions that we commonly get from people. So I'm going to stop part of the way through this seminar and take some questions, and then we'll entertain questions afterwards as well, because we would like it to be interactive. The hormonal response is unique to each person as their own preference. So we should not consider hormone replacement without understanding that. The normal age to go through menopause is 35 to 55. And many women may live, if they live long enough, more than half their life without their cycle. When after the age of 55 does a woman's risk of breast cancer. Now I'm going to stop for a second here and have everybody mute themselves, because then it will be easier for all of us to hear. Thanks so much. Why do we consider hormone replacement? Relief of symptoms, prevention of memory loss, heart health, bone production, growth and repair. Yes, these are hormones of growth and repair. Believe it or not, estrogen is, testosterone, DHEA, growth hormone, and even insulin. So we do have our patients take their hormones. If they're having surgery, right up to surgery and continue immediately after, because they heal better. It's different than vitamins, which people would take, they'd stop taking about 10 days before surgery and then resume 4 or 5 days after surgery, because they really are hormones of growth and repair. There's a lot of symptoms of menopause. It's not just about hot flashes and night sweats. Yes, vaginal dryness is a problem. What we can do is write a prescription for something compounded to be applied vaginally if there's a lot of vaginal dryness. Anxiety, mood swings, irritability, depression It's not about taking an antidepressant. In today's medicine, a personalized approach. It is about looking at the cause of the problem. Insomnia is a big symptom. Loss of sexual interest, hair growth on face, painful intercourse, panic attacks, weird dreams, gas, bloating, indigestion, bone loss, pain in the ankles, knees, wrist, shoulders, and heels. Hair loss is one of the most common symptoms I get. Hair loss can be due to low progesterone. It can be due to testosterone converting to dihydrotestosterone. It can be from low biotin because you don't have a healthy gut. It can be from really a myriad of things, including your thyroid not functioning as well as it could. Frequent urination, snoring, sore breast, vaginal itching, lower back pain, bloating. Yes, these are literally symptoms of menopause. Urinary tract infections, heart racing, varicose veins, urinary leakage, dizzy spells, panic attacks and anxiety, waking. The average woman gains 20 pounds at menopause. She does not have to. Skin feeling crawly, migraine headaches, memory not as sharp. All of these are symptoms of perimenopause and menopause that can very much be mitigated. Estrogen is not quote unquote evil. A lot of people think that estrogen is a terrible hormone. It's not. It has 400 functions in the body. It does stimulate the production of choline acetyltransferase, an enzyme which helps prevent Alzheimer's disease. In fact, estrogen equals memory. It increases metabolic rate, so it burns fat. It improves insulin sensitivity, so insulin works better in the body. It does regulate body temperature, helps prevent muscle damage, helps maintain muscle, and improves sleep. There's estrogen receptors all over the body, including the eyes and including the colon. So estrogen helps reduce cataracts, macular degeneration, and glaucoma. It also helps prevent colon cancer. It is a very important hormone for heart health. It maintains elasticity of the arteries, dilates small arteries, increases blood flow, inhibits platelet stickiness, and it even decreases the accumulation of plaque on the arteries. There's not many things that do that except for pomegranate juice. Pomegranate juice, 2 to 4 ounces a day, will also decrease and prevent the accumulation of plaquing. There are so many studies now looking at estrogen helping with heart health and also helping with memory. Estrogen enhances magnesium uptake and utilization. It's even great for our skin. It maintains the amount of collagen in the skin. It lowers blood pressure. It decreases LDL, bad cholesterol, and helps prevent its oxidation. It really does help maintain memory, increasing reasoning and new ideas, helps with fine motor skills. It increases the water content of the skin. It's a smoothness and softness, and enhances the production of nerve growth factor that has a very positive effect on emotions. It even increases good cholesterol and reduces the overall risk of heart disease by 40 to 50%. It lowers lipoprotein A, which is a risk factor for heart disease. It acts as a natural calcium channel blocker to keep the arteries open, and increases energy, mood, concentration, and maintains health. It helps increase sexual interest. It lowers homocysteine. Homocysteine is an amino acid that, if it's high, increases your risk of Alzheimer's, breast cancer, bone loss, heart disease, and stroke. No one has to have a high homocysteine. That's such great news. It is fixable in every single person. Estrogen even decreases wrinkling. It helps prevent tooth loss, and it aids in the formation of neurotransmitters such as serotonin. You can have too much estrogen. This is called estrogen dominance. Perimenopausally, menopausally, PMS, PMDD, PCOS, which is polycystic ovarian syndrome. All of these tend to be an estrogen dominant state, where we have more estrogen and not enough progesterone for balance. And then you can get cervical dysplasia, depression with anxiety and agitation. There's an increased risk of uterine cancer, put on weight around the abdomen, hips, and thighs. People can have water retention, headaches, poor sleep, panic attacks, swollen breast. If you're still cycling, the cycles tend to be heavier. There is an increased risk in breast cancer and autoimmune diseases like lupus and rheumatoid arthritis. Your thyroid may dysfunction. You can have fatigue, mood swing, uterine fibroids, bloating. So it does matter if estrogen is balanced. How do you have too much estrogen anyway? Well, if you take too much, it's now becoming a very common scenario. So it's important. Women only make micrograms, baby amounts of estrogen at their peak function at the age of 25. It does not take much hormone to help the woman have youthful skin, decrease the risk of cancer, have memory, prevent heart disease. Also appeared in elimination of estrogen. Most of the estrogen is cleared through the liver. Some of it is cleared through the gut or GI tract. Lack of exercise can cause estrogen dominant. The next one we're seeing more commonly now, a diet low in grains and fiber. Many people now are avoiding gluten, but they do need grain. So there's good grains such as quinoa. There's environmental estrogens. In fact, there's many, probably 50 to 75% of them that mimic estrogen. The most common is phosphatase. There's three kinds of estrogens that women make: E1 estrone, E2 estradiol, E3 estriol. I love it in medicine that most things are from a Latin derivation. So it's just one, die for two, try for three. E1 is the main estrogen the body makes postmenopausally. High levels, many researchers believe, may increase a woman's risk of breast cancer. Estradiol is all of these other functions. It really does work as an antioxidant. It gets rid of free radicals, increases serotonin, helps with the absorption of calcium, magnesium, zinc. E3 estrogen is very important because it helps prevent breast cancer. In fact, E3 estrogen was discovered almost 100 years ago in 1924 and published in JAMA. So
You've been fed.
Information. Estriol is so important to help prevent breast cancer, but because it's weaker, it doesn't have the same bone, heart, or brain protection that estradiol does. I put a few medical references in here. And the reason I did that is I still get some people saying, oh, there's nothing in the medical literature on all of this. That is absolutely positively not true. Estrogen has been suggested to be a state of accelerated aging if it is deficient. So estrogen deficiency is problematic. How about estrogen and heart health? 2019 study. Reports have correlated the use of estrogen for the treatment of menopausal symptoms with very beneficial effects on the cardiovascular system, meaning heart health. 5 and 10 years they looked at this, and they showed that estrogen was cardioprotective. So it does help prevent heart disease. But estrogen always has to be given by mouth, or not by mouth, but on the skin. It has to be transdermally. Don't ever take it by mouth, because then it increases blood pressure, drives up triglycerides, which is the fat content, increases estrone, the bad estrogen we don't want to replace, can cause gallstones, can elevate liver enzymes. It does increase sex hormone binding globulin, which will decrease testosterone. It interrupts tryptophan metabolization and the metabolization of serotonin. And this is the big one I think a lot of people think about. If you take estrogen by mouth, it can lower growth hormone, the hormone that keeps you young. It also has a prothrombotic effect if you take estrogen by mouth, meaning it can cause blood clots. It drives up C-reactive protein, which is an inflammatory marker. Estrogen on the skin is anti-inflammatory. By the mouth, it causes inflammation. Also, estrogen given by the mouth increases carb cravings. So we always put it on the skin. It should go into an area of fat cells. So for most women, doesn't matter what they weigh, they have more weight in the thighs. So we put it on the thigh and rub in for 2 minutes. We do rotate sites, so it's not in the same place all the time. This morning I put mine on my right thigh. I'm 66 years of age, and I don't know what I would do without my female hormones. It really does keep my brain really sharp. So the method of estrogen delivery is very vital. From a study from this year, estrogen should always be prescribed transdermally, meaning on the skin, or if you need to add some vaginally, you can. The use of estrogen on the skin, in stark contrast to orally, has been linked to a lower risk of deep vein thrombosis, meaning blood clots in the leg, cholecystitis, which is inflammation of the gallbladder, osteoporosis, everybody knows what that is, and stroke. So again, from a study, even this year, estrogen should be on the skin. So we do have a compounded, so we can have both E2 and E3 put together. Now there are a few people that like an estradiol patch. An estradiol patch would still be on the skin, but then you would still need a prescription for E3 estrogen compounded to add to that to help prevent breast cancer. We always have a lot of questions on estrogen, so I'm going to stop for a minute and take questions. Do we have any today?
Do we just speak up if we've got them?
Absolutely, or you can type it in the chat box and the moderator will read them, but feel free to speak up.
I'm on an estradiol patch because that's what my doctor prescribed for me. But I have had good luck with coming to her and saying, yeah, I think I need to add. And so I could just go to her and say, I want to add E3.
Absolutely, and that would be compounded. You can still use the patch if that works for you, and then you would put the E3 estrogen on the thigh, rub in for 2 minutes, rotate sites, so you would just have two separate prescriptions. That would work.
I do that with my testosterone already, so I'm used to that.
Ah, very good. Now, if you have testosterone, okay, that can be put together with the E3 estrogen into one cream. Usually what I suggest is that people keep them separate initially to make sure there's no problems, and then after 90 days you can have them put together.
Great, thank you.
You're welcome. Other questions? Feel free to unmute yourself, or you can type it in the chat box.
I have a question, if you can hear me.
I can, go ahead.
I have been taking the bioidentical by mouth. And so the studies you're talking about this year, about it, you know, needing to be not by mouth, were those studies on the bioidentical or on the other type?
That's a great question, and it was done on estradiol that was bioidentical. So the study that I just did was done on estradiol patch.
We do have.
I guess I need to talk to my doctor, huh?
Absolutely, and the pharmacy can always help you in this. They can talk to your doctor and work with them and help develop the right dose that would be perfect for you.
Wonderful. Thank you.
Oh, you're very welcome.
We have a couple more questions from the chat. The first one is, could you speak more about taking estrogen when your mother has had breast?
Absolutely. Thank you for asking that question, because I have a family history of breast cancer on both sides of my family. In fact, I had one grandmother that I never got to meet. She died in World War II before I was born of breast cancer. So she died during that time frame. I have cousins and aunts on both sides that have had breast cancer. So in our family, it's very common. So what helps prevent looking at this? Number one, is it safe? It is if the right doses are prescribed. Number two, it has to be in the right locations, like the estrogen on the skin. It has to be the right estrogens. We do look at also estrogen breakdown. That is a urine test where we look at how estrogen is metabolized. So to keep it simple, it's broken down into 2, 4, and 16 hydroxyestrogen. The 2 is the good one. You want mostly that one. You need a little bit of 16 for bone structure, and you don't want any 4-hydroxy. If you have 4-hydroxy, there is a major increase in breast cancer. And if that's happening, the good news is we can fix it in every single patient. We just have to measure it. So what we like to do, the best way of looking at all this, because the hormones are a hormonal symphony, is to measure by saliva testing all the hormones, and then the breakdown product would be a urine test. Other questions?
Yes. How is it determined that we need treatment? Symptoms or labs and/or?
All of the above, because it's not just about symptoms, although as you saw, they're very important. We want to look at the lab because we're looking at the idea here of resolving symptoms, but also prevention of disease. We want to prevent heart disease, or at least put it much farther in the future. Let's face it, if everybody in your family's had a heart attack or stroke, are you probably going to have one? Yes. But instead of having it at age 55, how about if we're hormonally balanced and we put it way far in the future, like 90 or 95, okay? You can't change your total genetics, but what we can do, the science is here, is to augment and balance these things better. So when we're looking at memory loss, it's the same thing. We want to help prevent it. Estrogen really does equal memory. Is it ever too late to start? It's not. So it is better if you lose estrogen at menopause, that we start it then. And by the way, not all people lose estrogen at menopause. If you tend to be a little on the heavy side, estrogen is stored in fat cells. So you may lose progesterone first and lose estrogen later. So we want to replace it when you lose it, and we want to have it balanced with the other hormones. Even if you were 80 and you were never on hormones and you were a candidate for them, meaning you didn't have breast cancer that was hormonally related, would we consider putting you on hormones? We would, because of the heart health and brain protection that it affords.
Yeah, my doctor didn't want to put me on testosterone, but when I got a MRI that showed I was atrophying back muscle after over 35 years of dancing, she agreed to do a testosterone test and went, gee, you have no testosterone in your system.
Well, and so when you did the test, how are you taking the testosterone?
I am taking it by, I'm getting it from, I'm getting it in cream from this group right here.
Okay, great. And so you want to make sure that you have it remeasured by saliva testing so that you have the right amount. You don't want too little, you don't want too much.
Yeah, I think we got a little over and now we're pulling it back down again.
Okay, perfect.
But my last remaining really nasty thing I have is I'm 30 pounds overweight. So.
Well, it is a hormonal balance. And so in losing weight, some of the hormones we're going to talk about tonight, like cortisol, if you're stressed, it's hard to lose weight. If your thyroid's not perfect, it's hard to lose weight. If your blood sugar isn't perfect, it's hard to lose weight. So if we balance all those, it does help with weight loss. I'll refer you to my book that they carry at the pharmacy. Why?
I've got it.
Okay, good.
Got it already. Bought it after your last talk.
Good, I'm glad you have it. Hmm. I'm going to move on now to progesterone, and then we'll take some more questions. Progesterone does balance with estrogen. It has to. So symptoms of progesterone loss: anxiety, depression, irritability, mood swings, insomnia, pain and inflammation, bone loss. Estrogen maintains bone, but progesterone builds it. Testosterone, which we're going to look at next, builds it and is strength of bone, because you also want it to be strong. If you don't have enough progesterone, you can have excessive cycling, hypersensitivity, so you really are hypersensitive all the time to things, nervousness, migraine headaches, weight gain, decreased libido, decreased good cholesterol, and again, you can have low progesterone at any age. Stress is a big cause of low progesterone, so can antidepressants. Sugar is a common cause, not having enough thyroid hormone. Thyroid is the conductor of the hormonal symphony. Also, deficiency of vitamins A, B6, C, and zinc, they're needed to make progesterone. So sometimes people, honestly, they just need a multivitamin. You don't want to use the synthetic form, though. That's progestin. Progestin does not reproduce the same actions that natural progesterone does. And unfortunately, these words sound the same, but progesterone is what is the natural form. And sometimes people misuse the terms. Progestins can increase appetite, cause weight gain, fluid retention, irritability, depression, headache, decreased energy, bloating, breast tenderness, decreased sexual interest, cause acne, hair loss, nausea, insomnia, and honestly, I have seen all of these. It can also interfere with the body's own production of natural progesterone. It doesn't balance estrogen. It stays in the body longer. Natural progesterone and other natural hormones stay on the receptor sites 90 days, which is perfect. The synthetic ones, though, actually stay on 6 months. So what does synthetic mean? People always think natural means it comes from a plant. Actually, that's not the definition of natural. Hormones do come from soy or yams, but the true medical definition of natural is the same chemical structure that God gave you to begin with. Synthetic, like progestins, are not the same chemical structure, so they don't balance estrogen at all. They can cause spasm of the coronary arteries. They do increase your risk of breast cancer. I'm going to show you some actual studies. They stop the protective effects that estrogen has on the heart. They can make the symptoms of progesterone loss worse. They can increase bad cholesterol, lower good, protect the uterus from cancer, but not the breast, and they counter many of the positive effects that estrogen has on serotonin. So what are these studies? I commonly get other doctors asking me, oh, there's no study showing this, but there are. Look at these two. Progestins increase breast cell replication and growth to the stimulation of the estrogen receptors. So that does increase the risk of cancer. What happens with natural progesterone? It's different. It balances estrogen, leaves the body faster. It's a natural diuretic, so it gets rid of fluid. It's wonderful for sleep. It has a calming effect and lowers blood pressure, helps the body use and eliminate fats, lowers cholesterol, increases scalp hair, helps balance fluid in the cells, increases the beneficial effects of estrogen on blood vessels. It also increases the metabolic rate, so it helps you lose weight. It's a natural antidepressant. It gets rid of inflammation. Almost every disease you can think of, including COVID, are inflammatory in nature. It stimulates the production of new bone and enhances the action of thyroid, improves libido, restores the proper cell oxygen levels, promotes the good immunity. It's neuroprotective, so it helps the nerve endings. It induces conversion of E1, that estrogen that's not as nice, to the inactive form, and has been shown to decrease the risk of breast cancer. Are there studies showing that? There are. Again, we always get lots of questions on this. Natural progesterone has been shown to decrease the risk of developing breast cancer. Large trial, they literally looked at 80,000 postmenopausal women for 8 years that took different kinds of hormone replacement. Women who used estrogen in combination with synthetic progestin, the synthetic form, had a 69% increased risk of developing breast cancer when compared to women who never took hormone replacement. Women who used progesterone in combination with estrogen, though, had no increased risk of developing breast cancer compared to women that did not take hormones, and also had a decreased risk in developing breast cancer compared to women that used progestins. So there's your reference. Another one, same researchers, 40% increased risk of developing breast cancer in women who used estrogen with a synthetic progestin. In women who used estrogen with progesterone, the natural form, there was a trend toward a decreased risk in breast cancer. And yes, even more. Studies have shown that progesterone does not induce estrogen-stimulated breast cell proliferation. So it does not increase the risk of breast cancer. So if you had a hysterectomy, old school thinking is you only need estrogen. It doesn't matter if you had a hysterectomy or not. You always need progesterone for balance. More references. So there's much in the medical literature, even more references on the subject. Now, you don't want to use just progesterone without estrogen. If the estrogen's gone, you do have to balance it. Because if you just get progesterone by itself, you do put on weight, your blood sugar goes up, your cholesterol goes up, you have fatigue, fat storage. Even if you have estrogen, but you give too much progesterone, that's not good either, because it drives up cortisol, your stress hormone, causes carb cravings, insulin resistance, laxity of the muscles, so you get backaches, compromises the immune system, causes incontinence, and decreases growth hormone. So yes, you can get too much of a good thing. It has to be a perfect balance. So it really is all about balance. So progesterone can be given as a cream or a capsule. If you have a hard time sleeping, then it should be a capsule, because then it crosses the blood-brain barrier, hits the GABA receptors, and has a nice calming effect. There's a trend now toward using progesterone for peri and postmenopausal women, whether you have insomnia or not, as a capsule, and to use a cream for women who are younger for PMS, PCOS, PMDD, etc. Yes, more trials. This study measured blood levels of progesterone in 6,000 women that were premenopausal. Women with the highest levels of progesterone who had regular cycles had an 88% reduction in the risk of developing breast cancer. So premenopausally, if you have low progesterone, and it's almost always the first hormone that goes down, it is important to replace that even before menopause, so you have the perfect balance. I'm going to look at testosterone, and then we'll stop again for questions. Testosterone is important. When it comes to menopause, only 1/2 of women ever lose testosterone. Again, I'm at 66, my testosterone's normal, so will I lose it? No. The other half of women end up with too high of testosterone or too low, about evenly split. But testosterone is very important for sexual interest and sense of well-being. It does increase muscle mass and strength. It maintains muscle. Thank goodness it helps the skin from sagging. It decreases excess body fat, helps maintain bone strength. It helps with depression, and it aids with pain control. So if you don't have enough testosterone, you can have muscle wasting and weight gain, fatigue. You don't tend to feel as good about yourself. Good cholesterol may be low. You may have dry, thin skin with poor elasticity. thinning and dry hair, droopy eyelids, sagging cheeks, thin lips, anxiety, and the memory tends not to be as sharp. You can have low testosterone at any age. One of the most common reasons people have low testosterone is oral contraceptives. Statin drugs are another one, as are stress. So we do have a compounded. The synthetic form is by mouth. It's called methyl testosterone. There's an increase in cancer of the liver. So we do put testosterone on the skin, rub in for 2 minutes, do rotate sites. If you don't rotate sites, you will grow hair there. So you have to rotate it. Now, this last part here is very important. If you've had breast cancer and it's hormonally related, and right now you're not a candidate for estrogen and your estrogen is low, you cannot take testosterone. I see some doctors do this. They give that patient testosterone, it makes them feel better, but it dramatically increases plaque formation and increases the risk of developing heart disease significantly. You can raise testosterone in other ways. Exercise is a great way at any age to drive up testosterone. Decreasing caloric intake, increasing protein in the diet, the amino acids arginine, leucine, glutamine, getting enough sleep, weight loss, stress, and if you're deficient in zinc, you may have low testosterone levels. High testosterone can occur at menopause, but also with polycystic ovarian disease. And high testosterone we want to help with. We don't want to leave it that way. We don't want it overprescribed either. Sometimes women take testosterone and they don't need it. And doctors give it to them because, oh, it's the feel-good hormone. But it's not that, because it can cause eventually anxiety, depression, fatigue, hypo or hyperglycemia, meaning blood sugar can go up or down, anxiety, agitation, facial hair, acne, weight gain. You can get hair where you don't want it. And the last one is significant. If testosterone's high for any reason, because you have PCOS, because it went up at menopause, or because you're overprescribed, it does increase your risk of heart disease. So we don't want to leave it high. There's many herbal therapies that can lower it, like saw palmetto, EGCG, which is green tea. There's a lot of ways to lower testosterone if it's too high. So the ovaries make estrogen, progesterone, and testosterone. Questions?
We do have one. One of the people said, I am 60 years old and was diagnosed with severe osteoporosis in part due to hyperparathyroidism and parathyroidectomy. I have not taken any BHRT, but hear that it would be good to start, despite my endocrinologist saying that 60 is the cutoff. Also, what would help dietarily besides calcium, magnesium, vitamin C, and D, and collagen?
Well, if you've had hyperparathyroidism and it's treated, meaning you've had 1, 2, or more of your parathyroid glands out, is usually the way it's treated, then there's not a counterindication, as long as you've not had breast cancer, to actually taking natural hormones. So it may be that the endocrinologist is a parathyroid expert, which is great. I'm glad you saw one, because you don't want to stay with hyperparathyroidism, but it's not a counterindication to taking natural hormones.
Someone also asked, what are the names of the saliva and urine tests that she should tell her doctor to do?
Well, there's a number of different saliva tests that are available. There's 28-day tests, there's 6-day tests, there's 1-day test. If the patient's younger, we do tend to do more testing than if they're postmenopausal, then usually a 1-day test is fine, because the hormones don't jump up and down. There's a number of companies that make them. Genova would be one. ZRT is probably one of the most common companies that makes it. There's a couple of other, like Access Labs, Doctor's Data, but by far ZRT and Genova would be the most common. So let's move on to DHEA and cortisol. It is a hormonal symphony. So these hormones, DHEA and cortisol, are made in the adrenal glands, the glands that sit above the kidneys. But DHEA makes estrogen and testosterone, so they do interface with each other. And DHEA does decline with age. And part of the reason that your memory's not as sharp, you have bone loss, you don't have as much energy, as if DHEA goes down. So we do replace this if you're a candidate for it. DHEA levels can change when you have stress, though, at any age. So what does DHEA do? It lowers cholesterol, decreases the formation of fatty deposits, helps prevent blood clots, increases bone growth, promotes weight loss, increases brain function, increases lean body mass. It really does give you a great sense of well-being. It helps you deal with stress. Thank goodness in today's world, it supports the immune system. It helps the body repair itself and maintain tissues, decreases allergic reactions, and lowers triglycerides, the fat content in the body. So again, you can have low DHEA at any age. Even smoking inhibits the production of an enzyme which is needed to make DHEA, but stress is a common reason. When you're first stressed, DHEA goes up and then it becomes too low. So replacement of DHEA does all the things here. It improves sleep, improves quality of your life. It activates the immune system. It increases the feeling of wellness. It helps with bone structure, blood sugar, memory, stress. It lowers triglycerides, all these wonderful things. Women are more sensitive. So before the age of 60, they usually need less DHEA as a dose than men do. You can have too much. So if you have DHEA excess, you can get any of these symptoms or more. I lovingly call this going postal, so you don't want any of these things either. That's why we measure this by saliva testing as well. Its companion hormone is cortisol. This is your stress hormone. I took this picture and the pictures of dogs from the book called Dog Play, along with the quips. I love dogs and cats both, but I thought the quips that went with these pictures were just grand. I mean, look at this dog, look at these eyes. I mean, oh, so cute. Don't microanalyze every nice breeze that comes your way. Please do not do that. If you're hypervigilant, it's hard to ever normalize cortisol. It's the only hormone in the body that increases with age. In this crazy COVID world and 365, 24/7 overbooking, and people are working from home now. So they work day and night. It seems like they never stop their work day. I love this poem from Carl Sandburg. Time is the coin of your life. It is the only coin you have. Only you can determine how it will be spent. Be careful lest you let other people spend it for you. So be cognizant of how you spend your time, because isn't this guy cute? Life is not a busy contest. Cortisol does balance blood sugar. It helps with weight control. People say to me, oh my gosh, I can't lose weight. Stress is the #1 reason why they can't. It also helps your immune system, bone turnover. If you stay stressed, you can break down bone. Important for stress reactions, sleep, protein synthesis, and it's anti-inflammatory. In fact, one study suggested that as many as 75 to 90% of visits to primary care doctors were stress-related. This is before COVID. Another great picture of a dog. Consider fresh air, God's Prozac. So if cortisol stays high, then your immune system is compromised. You do get bone loss, fatigue, irritability, binge eating, confusion, shakiness between meals. The memory's not as sharp. If you remember in high school, in college, even on your job, they would always tell you if you had a test to take or something new to learn, relax, because your memory's sharper. Other consequences of elevated cortisol: low energy, night sweats, insulin resistance, so your blood sugar changes, cholesterol, blood pressure, and triglycerides go up. Thin skin, easy bruising, muscle weakness, weight gain around the middle. You don't tend to sleep very well. You have impaired conversion of T4 to T3, and it does promote what we call leaky gut syndrome, where your gut does not work as well. 70% of your immune system is in the gut. So we will be doing a seminar on gut health. So I hope you join us for that one as well. Abnormal cortisol levels are associated with all these diseases, and all of these too. This is from the actual medical literature. When you're first stressed, as we said, cortisol goes up. When you stay stressed, you have to have cortisol to live, so your body will make it preferentially over any other hormone. In fact, if you don't have cortisol, you die in 7 days. So your body will make it at a low level, but still make it. So if you have low cortisol, what does that mean? It does compromise your immune system. You may have lack of stamina, emotional paralysis, you can't make a decision, poor wound healing. Drug addiction and alcoholism are more common, allergies. You may have what we call unresponsive hypothyroidism. That's when your doctor or other healthcare provider gives you thyroid hormone because you need it, but it doesn't work. You tend to feel overwhelmed. So how do you have low cortisol? Long-term stress, along with all these other reasons, nutritional deficiencies, unhealthy gut, inflammation, toxin exposures, aggressive exercise without replenishing nutrients, depression, allergies, blood sugar not being normal, and poor sleep hygiene. So what do we do for this? If cortisol is too high or too low, we start with a multivitamin. Stress reduction techniques, prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques, acupuncture. All of these are important. Adaptogenic herbs, ashwagandha, rhodiola, ginseng. The conductor of the hormonal symphony is thyroid, as we've said. But this hormone here, pregnenolone, is the mother hormone. It makes estrogen, progesterone, testosterone, and DHEA. And of course, it's your hormone of memory, so it's hard to say and hard to spell, but it's made directly from cholesterol. Sometimes cardiologists forget this, because if you get your total cholesterol below 140, this happens sometimes with different medications. If you get your cholesterol below 140, then it doesn't make pregnenolone very well, your memory's compromised, and it doesn't make the other hormones either. Pregnenolone does decline with age. At the age of 75, most people have low pregnenolone. We can replace this hormone as well. And this one is a serum test, so it's done by blood. Pregnenolone does regulate the balance between excitation and inhibition in the nervous system. It increases resistance to stress. It improves energy both physically and mentally, enhances nerve transmission and memory, reduces pain and inflammation, and blocks the production of acid-forming compounds. It modulates the neurotransmitter GABA, which is a calming neurotransmitter. It helps to repair nerve damage, promotes mood elevation, improves sleep, enhances acetylcholine transmission, and it modulates the NMDA receptors. These help with pain control, learning, memory, and alertness. So you can have low pregnenolone at any age due to stress, poor eating habits, cholesterol being too low, thyroid not working, and long-term illnesses. So what are symptoms of not enough pregnenolone? Arthritis, depression, memory's not as sharp, fatigue, you don't deal with stress well, insomnia, and lack of focus. Pregnenolone helps with memory, but it has been used for many other disease processes in the body. And that leaves us with melatonin. Melatonin is a very important hormone. This is a saliva test. If melatonin goes up, serotonin goes down. So we like to measure it before people take it. It's made in the pineal gland in your brain, the retina. It is made in your GI tract, the gut, and white blood cells. If you eat too much sugar, this can lower melatonin. The body does need B vitamins to convert melatonin from tryptophan. The number one reason people have low B vitamins in today's world is stress. So many people do need to take a B complex. B vitamins and vitamin C are water soluble, so they're taken twice a day. What does melatonin do? Yes, it helps with sleep, but it also affects the release of sex hormones. It's major for the immune system. It acts as an antioxidant. It blocks estrogen from binding to receptor sites, decreases cortisol, helps balance the stress response, helps prevent cancer, improves mood, improves sleep. It does stimulate the parathyroid gland. So for the person on tonight who had hyperparathyroidism, this would not have been for you until you were treated. It stimulates the production of growth hormone. Again, the hormone that keeps you young. It's great for heart health, and it helps protect against GERD or reflux. It's used to treat many, many things. In fact, we even use melatonin now in larger doses to treat stage 4 breast cancer with and without chemo. So how do you get low in melatonin? Alcohol, caffeine. The biggest reason in today's world is electromagnetic fields. I try not to get on this computer after 7 o'clock unless I'm giving a talk like tonight. Tobacco and cell phones. All these things lower melatonin. If you have too much melatonin, though, you can have daytime sleepiness, fatigue, and depression. Headaches. It does alter cortisol negatively if you have too much melatonin. So we want to measure. Intense dreams, nightmares. And again, it suppresses serotonin. So if you're younger and you have PMS, this is a hormonal disorder that's characterized by monthly reoccurrence of physical or psychological symptoms. It's estimated that 70 to 90% of women at some time in their life have some symptoms of PMS. For 20 to 40% of women, the symptoms are very severe. But we can do a saliva test and go back and balance the hormones because there's a lot of different symptoms. I'm not going to bore you tonight by reading them. So I'm going to show you several slides, but you can see here on the first slide, they're in alphabetical order, and we've only gotten to C on the first slide. So here's some more. There are a lot. There are many for PMS, but again, very treatable. So you can look at dietary factors to help. Less sugar is key. Nutritional supplements can be helpful. Exercise, if you need thyroid medicine. Botanicals can be helpful, like chasteberry would be very beneficial. Progesterone, almost all patients with PMS tend to have low progesterone. When we replace it, it should be the natural compounded form. Some people have candidiasis or yeast. If we treat that, the PMS is better. And then, of course, mind-body therapies are great. How about polycystic ovarian syndrome? When I was in medical school 45 years ago, this was called Stein-Leventhal. They told me I would see 3 or 4 cases in my whole career. I see 10 cases a month. So what is PCOS? It's when testosterone's high, you have more cysts on the ovaries, and your cycles tend to be irregular. And you can have any of these symptoms. There's other diseases associated with PCOS: infertility, obesity, heart disease, diabetes, high blood pressure. There is an increased risk in hormonally related cancers. We can diagnose PCOS at very young ages, 16, 17, 18 years of age. This is a very treatable disease process. We can treat it with medications, fiber, We do want to help with blood sugar because many of these people have abnormal blood sugars already or go on to have diabetes. Reducing stress, good fats like fish oil, drinking enough water, herbal therapies and nutrients all can help with PCOS along with progesterone. So in summary, and we're going to take questions, all the hormones in the body are designed to work together. If one is altered or deficient, it will affect the actions of all the other hormones. That's the reason why we want to offer a personalized approach, a customized approach. That's where medicine is in 2020. We want to use natural bioidentical hormones that are compounded. One size does not fit all. Questions?
Yes, I have a question about DHEA. I'm taking 25 milligrams orally every day, and I feel really good. But I have also heard that it's not good to supplement with DHEA. Can you comment?
Have to measure. And so we always measure. Again, saliva testing would be the best measurement because it's orally and not on the skin. Could you measure by blood? You could. But the best way, and actually the only way to measure cortisol, the companion hormone, there's 6 trials, that one does have to be measured by saliva. So we'd like to measure the DHEA and cortisol together by saliva. Could 25 milligrams be the right dose? It could, but I would only be guessing. So you can come on into the pharmacy and they can do saliva testing and you can take a look at the dose.
Is it like the estrogen and progesterone in that it's better to take it on the skin rather than orally, or doesn't it matter?
It's most commonly prescribed orally worldwide, and it's usually given in the morning because it invigorates you. So we usually tell people not to take it at nighttime, but in the morning is an easier way to do it.
Okay, thank you.
You're welcome. Do we have other questions? Please feel free to unmute yourself, or please feel free to type into the chat box.
Just have a follow-up on that last question.
Yes.
I'm going to be tested in about 5 weeks via a urine test for DHEA and cortisol. And you mentioned that saliva is preferable in some cases. When might the urine test be preferable, or is it not?
Well, and urine tests are important to look at hormonal breakdown, okay, and to look at patterns. But we don't prescribe hormones off of the urine because it's a metabolite. It's not a direct measure of the hormone, it's a measure of the breakdown product. And again, the gold standard for cortisol is to be measured by saliva and not by serum, not by urine. It doesn't mean I don't do urine testing in my practice, and other practitioners who do this do use urine, but that we don't dose off of urine, okay?
Thank you so much.
You're very welcome. Great question.
Someone is asking where you're located.
Well, I'm in Michigan. My goal tonight in doing this webinar, honestly, is to help people be healthy. I have 5 daughters. I really want people to understand that hormones, if properly prescribed, properly tested, etc., are really great for people. It is really important to balance hormones. So certainly at the pharmacy, you can come on into wellness. They have many different practitioners that they can advise you to, or they can help your own doctor with prescribing. Again, my goal tonight was just to inform. I really want women to understand how their body works.
Well, that was very valuable information. And yes, just to reiterate, we also have a lot of practitioners all over the country, as Dr. Smith mentioned, and we have a certified hormone specialist, the director of pharmacy at Wellness Pharmacy, Marian Davis, who is also wonderful to do consultations and speak with you further. But Dr. Smith, thank you so much for a wonderful lecture full of just very, very valuable information. I know we all learned a lot, and I appreciate your time.
Thank you so much.
Yes, thank you very much.
everyone to be in.
Thank you. Thank you.
You're welcome. Have a good Thanksgiving, everybody.
You as well.